Hello, I'm Amy Francine. I'm going to be doing my case presentation on impetigo. So, the disease process is that it's a common superficial bacterial skin infection. It's also really contagious. It mostly affects young children, but it can occur at any age. The condition is noticeable by the presence of the vesicles or pustules that rupture, and it does form a distinct honey-colored crust around the mouth. There are two main forms. It's non-bullous impetigo, and that's the more common one. It's distinguished by grouped pustules and honey-colored crusts. Or it's bullous impetigo, and it's distinguished by large fluid-filled blisters. The pathophys of all of it is that it occurs when bacteria, which is mostly common Staphylococcus aureus, or less frequently Streptococcus pyogenes, enter the skin through the minor cuts, abrasions, or insect bites. Once it's inside, these bacteria release enzymes and toxins that cause tissue damage and trigger inflammation. The risk factors are young children. They are more apt because they have developing immune systems, and they have frequent skin-to-skin contact at daycare. Can also be because of skin injuries or trauma. Any break in the skin creates an entry point for that bacteria. Poor hygiene, that's something that can be because inadequate personal hygiene leads to increased bacterial colonization and the likelihood of infection. Crowded living conditions. Close living quarters can promote or spread the infection that is contagious as impetigo is. Otherwise, it's pre-existing skin conditions such as eczema weaken the skin's protective barrier, making bacterial infections more likely. So the symptoms of impetigo are honey-colored crusts. Its most recognizable symptom occurs when vesicles or pustules rupture and then dry, usually around the mouth. Redness and inflammation. That happens because the body's immune system response to the bacterial invasion causes localized erythema. Vesicles or pustules then form, and that's because of the bacteria and the superficial skin layers cause fluid-filled blisters. And then itching and irritation is because of the inflammation, which leads to itching and then can worsen the infection. Some people also have swollen lymph nodes. You can do some diagnostic testing. It'll be a physical exam, and that'll be the objective things that the doctor is seeing, like the crust lesions around the mouth. They can do a bacterial culture and sensitivity testing, and that's a swab to the infected area. And then gram stain. A gram stain will tell you like what bacteria it is, so you can give the person the proper antibiotics. I think that's about it. Thank you so much.